Hello, my dear friends. I am Dr. Arnab Ganguly. I am a practicing geriatrician, Chandanagar, in the suburbs of Kolkata. During my daily practice, I have to see a lot of patients, mainly elderly patients and patients with multiple comorbid conditions like diabetes, hypertension, ischemic heart disease, cardiovascular diseases, alongside the age-related problems like instability, loneliness, and the resulting kind of depression. So all these things I have to take care along with the primary diseases. And one thing I have noticed that whatever might be the main complaint of a patient that which might be a diabetes or hypertension or ischemic heart disease, there always is some complaint of gastric disturbance. That is a very common complaint that we always have to hear from our patients. So the majority of them are related to gastric regurgitation. So that is a very common and very disturbing symptom that we have to deal in the patients. There are multiple modalities, pharmacotherapies that are being used to treat gastric regurgitation. Today, we are going to talk a little bit on the dietary modification and the nutritional support rather than on the pharmacotherapy of regurgitation. This counseling, if done to the patients properly, helps a lot, and it can minimize the use and abuse of PPIs and gastrokinetic drugs. As we all know that PPIs and gastrokinetic drugs are used a lot and abused a lot also. We have seen patients who are taking over-the-counter PPIs without prescription for a very long time. And also we know that long-term use of PPI can lead to multiple chronic problems. So in order to avoid those, we need to counsel the patient regarding the problem of regurgitation so that misuse of PPIs and gastrokinetic drugs can be avoided. Now, coming to the main topic of regurgitation and the nutritional changes and modifications, dietary changes that can be done. First, to define it, the regurgitation is the backward flow of stomach contents into the esophagus, which can have significant nutritional implications if left untreated. Individual experiencing regurgitation, whether due to gastroesophageal reflux disease or other underlying conditions, may benefit from dietary modifications and nutritional support to alleviate symptoms and maintain optimal health. Now, coming to the things that can be modified to reduce the symptoms of regurgitation. First of all is avoiding trigger foods. Identifying and avoiding trigger foods that exacerbate regurgitation symptoms like spicy food, acidic beverages, excessive caffeine, chocolate, and fatty or fried foods. Choosing diets rich in fruits, vegetables, lean proteins, and whole grains to minimize irritation of the esophagus and reduce the risk of reflux episodes. Another thing that should be advised to the patient is eating smaller and more frequent meals. Consuming smaller, more frequent meals throughout the day can help prevent overeating. This aids in reducing pressure on the lower esophageal sphincter, a contributing factor to regurgitation. It is advisable to opt for balanced meals that include a combination of carbohydrates, proteins, and healthy fats to support overall nutrition and digestion. In this context, I would like to highlight a very common problem that we see in our patients is irregular timing of meals. What happens that patients do not have their meals, the breakfast, lunch, or dinner in time. They take it late. And when they take it late, they overeat because their hunger increases. And that overeating leads to reflux. So I always tell the patients to consume their meals in a particular time and in a particular schedule throughout the day. Irregular schedule can increase the risk of reflux much more. Then coming to the issue of hydration. Drinking plenty of water throughout the day to stay hydrated promotes digestion. Avoiding carbonated beverages and moderating alcohol consumption goes a long way in curbing acid reflux symptoms, as these can contribute to bloating and increase the risk of regurgitation. So drinking water is a very important thing throughout the day, particularly during the summer months in our country. Now coming to the modification of meal timing, avoiding large meals or heavy snacks close to bedtime is essential. This is because laying down shortly after eating can increase the likelihood of regurgitation. Having the day's last meal 2 to 3 hours before bedtime allows ample time for digestion before lying down or engaging in activities and reduces the chances of acid reflux. Normally, this happens mostly during the dinner, where people have a late dinner and can no longer stay awake and go to bed right away. That is to be avoided at all costs. At least the dinner should be completed, at least, not even uh, maybe 2 or 3 hours is not practical in a day-to-day life. At least 45 minutes to 1 hour before bedtime, the dinner should be completed. And after that, a little bit of moving around, walking, that should be encouraged so that the chances of reflux are minimized. Now coming to the question of nutritional supplements, if regurgitation is interfering with nutrient absorption or causing weight loss, nutritional supplements may be included into the diet under the guidance of a healthcare professional. Multivitamins, protein powders, and meal replacement shakes provide adequate nutritional intake and support overall health in individuals with regurgitation. So that has to be tailor-made according to the needs of the each and every patient, how much absorption is going on in the patient and how much replacement is required and what should be particularly given as a replacement. And consulting a registered dietitian is also an essential part of this. According to the advice of a dietitian, a personalized meal plan which can be tailored to individual needs and dietary preferences. A dietitian can provide valuable guidance on managing regurgitation symptoms through diet and optimizing nutritional intake to support overall well-being. By implementing these dietary modifications and seeking appropriate nutritional support, individuals experiencing regurgitation can be better manage their symptoms and maintain optimal nutrition for overall wealth and well-being. So these are the basic lifestyle and dietary changes that can be advised to the patient to improve the symptoms of regurgitation. And this should be a baseline advice to all patients with GERD. After that, pharmacotherapy can be considered where these things are not giving adequate results. The pharmacotherapy can be definitely advised, but at the same time, it should be taken care that that pharmacotherapy is not being misused. And after this, a little tough thing that we have to take care of when there are multiple comorbidities, there are a lot of other drugs that are being prescribed that can cause symptoms of gastritis or regurgitation. In those cases, we have to modify or change the molecule that is creating the problem and switch over to a better molecule. The most common molecule that causes gastric irritation in elderly patients, that is aspirin, an anticoagulant for prevention of cardiovascular disease. Many a times patients cannot tolerate aspirin. In that case, we have to switch over to other molecules, so it's clopidogrel or ticagrelor, or which causes a lesser gastric irritation. Another thing to be very careful about is the use of NSAIDs. A lot of patients take over-the-counter NSAIDs without consulting a doctor. Particularly in geriatric patients, NSAIDs can cause severe gastric irritation symptoms of GERD. In that cases, the proper history should be elicited in each and every patient, whether they are using NSAIDs over the counter for chronic orthopedic or muscular problem for the relief of pain. In that situation, much safer molecules are available which can alleviate symptoms of pain without causing gastric irritation, like tramadol or plain and simple paracetamol. So NSAID is a very big culprit, and over-the-counter and non-prescription NSAID use is a very big contributor to refractory GERD. Many patients don't bother to tell the physician that they are using NSAIDs for arthritis and other things. So in summary, the symptoms of GERD needs a multifaceted approach to control it properly. And the lifestyle and nutritional advice should be a part and parcel of management of GERD. instead of only prescribing a few tablets and capsules to the patients. Along with the prescription drugs, a proper counseling of the patient should be given to each and every patient, and that can help a lot in proper and effective treatment of GERD. So and that brings us to the end of the discussion. Thank you so much. Thank you for your listening.